vaccine clinics in communities and schools. Those are all positive developments.
It's more than hand sanitizer and masks. When Alberta schools open this fall, they'll offer a stronger protection against COVID-19, a vaccine. But the province won't allow students under 18 to get the shot here unless they have parental permission.
I think that Alberta's approach, where they don't recognize the mature minor role, which has been widely recognized in Canadian law for a number of years, is problematic.
The mature minor concept allows youth to make their own medical decisions, as long as they are deemed to have the capability to. Ontario announced they'll use the mature minor rule for their COVID-19 vaccines in schools, and Saskatchewan already has. Alberta Health Services also recognizes the concept, but not when it comes to schools. Instead, they're opting to follow the process for other school-based immunizations.
Not only is this creating confusion and inconsistency, but it's also potentially depriving people who can and should be able to make their own medical decisions of obtaining a vaccine to prevent potentially very serious health risks.
Dr. Dan Gregson says COVID is not an insignificant contributor to death in children, even as youth show more resilience in fighting off the virus.
The risk in children of getting admitted to hospital, getting into an ICU and dying of COVID is much lower than it is in adults. But the vaccine is going to make it even lower than that.
He says the clinics and schools will help in cases where busy or disadvantaged parents have found it difficult to access vaccines.
And it might help people who are on the fence about immunizing their children when they see other people being immunized at school as well. That might help them make the decision to move ahead and get their child immunized.
He says it's hard to tell how much uptake there will be. About 54% of Alberta children 12 to 14 are fully vaccinated, and 57% of teens 15 to 19. Stephanie Lasuk, City News.